the world, around the world, around the world, around the world. I should have a theme song or something. Hello, everybody. It's Duff here, and welcome to Around the World with Duff. That's me. And this over here is Around the World with Duff. I really want to welcome everyone to the show, to the live stream that's happening here in Toronto, Canada. Toronto, Ontario, Canada. Sometimes we just say Toronto, Canada, and we're like, what happened to the Ontario? But I wanted to welcome those of you who've watched the show before for tuning in. I welcome your questions and comments and queries. What's your language? And especially when talking to the guests or the guest, that really livens up the broadcast. So today is June 9th, Tuesday. 6 months in, people. 6 months. And it's episode 13. So I can't believe I've done 13 of these already. I was just going to do a few. I just came up with this idea out of nowhere. So now I actually have learned so much, and I'm so happy to do this 3 times a week. That's enough, because scheduling people and finding out, researching and everything like that is a full-time job. And I wish that I was getting paid to do this, but I'm just bringing you people the lovely joy of seeing my sweet little mug every day or every 3 days. That's probably the best. So for those of you who haven't joined the show before, for you virgins, the virgins out there, I'd like to welcome you. This show is me visiting different parts of the globe, talking to people of all types all over the world, and getting their perspective and gaining a broader perspective and broader mind on what's happening out there, minus the media, and going right into the heart of the people on the ground, finding out what their country is like, what their daily life is like, how they view everything that's happening. So it's not a huge political discussion. It's just bringing the facts, pretty much, and a personal view to the world's global sort of situation. So I'm really looking forward to my guest today. And so this show happens on Tuesdays, Thursdays, and Saturdays. I try to aim for about 1 p.m. I think I'm going to take a break next week, although I said I was going to take a break this week, and I threw myself into even more of a stressful situation than I was going to have 6 guests on one show instead of 1. Of course, why not? Why do I do this to myself? Oh my Lord! So this week is going to be interesting. And yeah, so I try to aim for 1 p.m. But it's really hard to schedule with people who live in Tomorrowland, which is basically anywhere east or west of Ontario. Yes. So today, my amazing guest is Dr. Tim Guimond. Guimond. If you are French, if you're not, it's just Guimond. And I'm really looking forward to talking to him. We're going to talk about stress and mental health and harm reduction, just a wide variety, basically wellness during this time of COVID-19. And Tim's been a doctor for, I think, about 100 years. So he should have a few opinions on what's going on in the world. He's also traveled extensively. He's also worked for major hospitals and organizations and community help groups. I mean, the guy he's a quantum mechanic. That just makes my head explode right there. So yes, so I want to give you a little sort of a little news update here on what's happening in the world. Number one for me is one of the Pointer Sisters died today. It's really sad. I'm not so excited. The song, I'm so excited and I just can't hide. I think that was my theme song all through I think it was the 80s, right? I had the cassette. So she was 69 years old, Bonnie Pointer. I think there were 3 Pointer sisters, but there's actually a whole family of pointers. They're not dogs. They're actually women. They had 5 albums. I thought that the Pointer Sisters had more than 5 albums, but they were huge in the 80s and 90s. And Bonnie Pointer wrote the classic Heaven Must Have Sent You, disco classic. I'm sure Tim was also discoing to it in his early years. Also, what's happening today is the funeral of George Floyd in Houston, Texas. And so I would like to pay tribute to George, who has really, what happened to George has spearheaded everything and ignited everything that's happening right now. It's quite incredible. Isn't it profound that one person can do this, right? I mean, it all has been looming anyway, and America and the world has had enough, and that's obvious by the death of George Floyd. So I'd love to pay tribute just for a few seconds to George, and Black lives do matter, and we do stand in solidarity with all our Black brothers and sisters and families. So yes, so that's it. This is an important day for that, and there still are protests going on, which is a sign that this is not going away anytime soon. And I heard somebody say today on a news program that the real work happens after. The real work is, the protests will end, but the work that's going to happen is after all of the protests end. So that's a really important thing today. Also today is is really hot here in Toronto, 30 degrees. So if you're going to go out, you could burn. The UV index is 11 today, 11. So you step outside and you're red. So put on some sunblock. That's 86 degrees Fahrenheit for I guess that's just America, actually. That's just the US. That's Fahrenheit, right? Everywhere else is Celsius. I want to say hello to Holly. Holly is in PEI. Hello, Holly. She tunes in every time. Thanks for tuning in. And to Karen Seville, she's over in the UK. Hello, Karen. Thanks for tuning in every episode. I really appreciate that, you ladies of the chorus. And so also in Ontario is our reopening stage 2 of here in Ontario, except, and this is really interesting, except Toronto. And I wonder why. Because so they're opening up pools and gyms and churches all over Ontario, but they're focusing on areas that are that have less cases. Toronto does not. We have 67% of the cases. Today, I think, was a 250. Where's my stats here? 230 new cases in the last 24 hours. So a lot of that is, of course, they've increased testing as well. So and testing has gone up. I think we're trying to do 20 grand a day or a week. So it's increased a lot, though. I also wanted to address CERB. Now, I had a talk with my friend, and she insisted that CERB is actually pronounced curb. And so I want to throw that out to you guys. Do you think it's curb or CERB? Why is the C silent when it's Canadian Emergency Response Relief? Do we say Canadian? No, we do not. We say Canadian. So why are we calling it CERB? Who made it silent? I don't know. Hello, LK. No idea who that is. Hello, LK. Thanks for tuning in. So I throw that out to you guys, and we'll ask our guest as well if he thinks it's CERB or curb. I'm also still intrigued with the country of Lesotho. This is the beautiful countryside of Lesotho. This is a landlocked country in South Africa. I think it's 1 million, or I can't remember what the population is, but it's completely surrounded by South Africa. This is also Lesotho. Uh, it makes me want to cry. Still, Lesotho has 4 cases. I'm just going to leave it on this actually for the whole episode. I hope Tim doesn't mind, because it's just the most stunning scenery I've seen ever. So they still have 4 cases and 0 deaths. So I would love it actually if someone from Lesotho tuned in. It's not going to happen. I also just want to recommend a couple of things that I've been watching in terms of, especially since this is George Floyd's funeral today. I think it's really important for us to educate ourselves, black and white, all creeds and colors. We all need to educate ourselves. The 13th on Netflix is a documentary on racism in America and globally, and I think it's a really important thing for us to all watch. It's the history, basically, of all that. And then also there's this really important film that I discovered called Free Trip to Egypt, and it's screening this Sunday online. Incredible documentary about a guy. I think he's from Toronto, from Canada, actually. We've got some logic says Serb. Yeah, Serb. Well, but which way though? Curb or Serb, Karen? Oh, it's curb if it wasn't Serb. Oh God, this is turning into a hilarious thing. Oh, Hockey Nut. Yes. Hello, Hockey Nut. Anyway, back to Free Trip to Egypt. Free Trip to Egypt is, thanks for joining us. Anyway, Hockey Nut. Free Trip to Egypt is this guy who brought together, I think about 6 or 10 people from all over the U.S. And offered them a free trip to Egypt. But he brought together people who were racist and who were prejudiced and who were black and white and all different types of people. And the experiment is extraordinary, watching these people and also the transformation from when, there was a woman in, I think, southern U.S. who was completely racist. And by the end of I won't spoil it for you, but there's a transformation by the end of the film. And it's really heartwarming and poignant. I highly recommend that. Karen says hello to Hockey Nut. I can't help but think of nuts when I like Hockey Nut. For me, the visual is not, oh, I'm nuts about hockey. It's actually nuts and hockey. Put the two together. Maybe it's because that's just my brain. So now I'd like to do what I do every show is a global, by the way, this is Lesotho, landlocked in South Africa, just for you guys to know. So I love to visit the daily stats. It's been 6 months since this all started in around January, although there's debate whether, the virus obviously existed before that and cases just weren't reported or it wasn't identified yet. But globally, we got 7,145,847,000 cases, 407,067 deaths. That has all jumped, but I think in a few days, 100,000 deaths have happened. That's a whole city, my friends. That's a whole city of people in a couple of days. This is not going anywhere. Canada is 96,244 cases and 54,833 have recovered. That's actually really good. I think that's pretty good. But we've had 7,835 deaths. Ontario in itself is 30,860 cases, which is a lot. It's the second in Canada, I think, next to Quebec. 492 have recovered, and 2,450 deaths. So I do not think that we should be opening up. These numbers are jumping rapidly. I really hope that we'll be careful in our releasing of the people. So whoa, my screen just jumped. Sorry. So this is Canada across the board. As you can see, Quebec is still huge numbers, and I think they're still pretty liberal with opening up. I haven't heard anything about shutting anything down. Ontario still very high, right? Still rising. You can see the curbs there. Alberta, everything's still pretty much happening. Saskatchewan, my home province, is at 654, 595, and there's, I think, only like a million people in Saskatchewan. 624 have recovered, so that's actually really good, and only 13 people have passed away. So yes, it's all quite shocking, isn't it? This is the population of each province. So that also, the number of tests. So as you can see, Ontario is really high in testing, which is great. I love that. What's not good is that Manitoba is not high in testing, or British Columbia, which has a population of 5 million and only has tested 158,000 people. I do not think that's good. But this, the testing is a big issue with a lot of people. And, a lot of tests are coming back. Like in Brazil, they refuse to post their tests now. So masks have become mandatory in Spain, which says something. The WHO reports the highest number of COVID cases in one single day was today. Testing is increasing. Canada is allowing family members from the US to come in as of today. Nepal protesters were water cannoned and beaten over government handling of COVID, which I think is horrible. And as I said, Brazil stopped publishing and running a total of COVID cases and deaths, which complicates things, when they're trying to figure out where it's spread and in which region. So yeah, there's a lot happening. I just thought I would give you guys an update. I like to do that before we visit different countries and talk to different people about certain situations. Before we go any further, I also just want to say, if you guys have any questions for Dr. Tim Guimond, we really appreciate it, especially you, Hockey Nut. Tim, hello from Don Ackerman and Chad in Nashville. Yeehaw! They're water skiing and have a grand old time down there. Karen is laughing. Just want to make sure and the tests are only 80%. Yes, that's also another issue about tests, and maybe Tim can tell us a few things about that as well. But yeah, before we get too far in of me blabbing away, I'd like to bring in Tim and we'll discuss a few things. Tim, are you there? Are you there, Mr. Tim?
Yes.
Hello. Oh, I can't hear you, Tim.
Oh, you can't hear me.
Hello, what? Dr. Guimond.
Oh, it could hear me earlier.
Got a bit of a delay. There's always a delay. I can hear you now.
Oh, okay. I'm not sure why it wasn't happening before.
There's always like a little delay. I know. We'll just let StreamYard catch up with us because we're just too quick on the draw.
Sounds
Can you
good.
hear me? Yeah,
I can hear you totally clearly.
Oh, now, okay. We still have a delay, but we'll. Welcome, Dr. Guimond. Thank you for coming on the show. I really appreciate it. It's been an interesting time. How are you faring during all of this?
It's been going pretty well for me. I had made a decision to leave a job. I had finished some extra schooling. As you explained, I seem to like school. So I finished up a PhD, and then I worked for about a year, and I was feeling pretty tired, and I decided I would take a break from working and just try to re-examine life. And then COVID happened, and now getting back to work is a bit more of a struggle. It's and like I'm sure we can talk about there's the impacts of COVID on everyone and their health because of COVID, and then there's impacts on the rest of people's health needs. So people are having harder times getting to see their family doctors for things.
Right.
Surgeries have been canceled, things that people, knew they needed addressed and were booked, months in advance because of the wait lists in their areas.
Yeah.
Now are having to wait even longer. And so all of that, I think, has been stressful on everyone, and it's hard to imagine how we keep everyone healthy and not have some access to all the services they need to keep them healthy.
Yeah, the resources. Yeah, I know that when all of this broke out, I just got back from Mexico and I was feeling sick. And I was also just about to leave for Halifax to go do a show. And I had a scratchy throat. And I was like, if I'm going to be traveling out and be amongst a group of, large group of people in the theater, I would like to just get tested. And it was not easy back then, that's for sure. And it certainly isn't. It's easier now, but the protocol was very different when it first started. And I called my doctor and he said, no, we don't want anybody coming into the office here. You have to go to the emergency. And I thought, oh God, okay. So I'm going into the epicenter of COVID, basically, right? They had cornered off the hospital and they had given me a whole, like, do you have this symptom? There was 3 or 4 symptoms, right? And I kind of had one. And then I thought, I have some tightness in my chest. I'm going to tell them I have that because I need this test. I have to have the test or I don't want to travel. Right. So they did blood work. They did everything, actually. EKG, the heart thing, they did a x-ray on my lungs and it was all clear, but wow, it was a process. And I was there for 10 hours.
Yeah. And I was talking to one of my friends who is a statistician and works at St. Mike's. They built tools to predict how many people are likely to be in the emerge, how many beds are going to be filled. And all those models won't work right now because everything has changed so radically. Right. And they said that the hospital still there is at 90% of their current capacity, all their beds, and with only half of the number of people going to the emerge as usual. So we know lots of people are avoiding emerges, right? Now, some of that, maybe these are things that, could have been dealt at a walk-in clinic and maybe people are going other places.
Yeah.
The other worry is that people are just like, I'm not getting this looked at. I don't care. I'm nervous about going to a hospital. And that sort of anxiety might keep you from getting the help they need at times. So it's some hospitals are saying they are like, you can fly through. Some things it's like super slow now. I mean, it's all as people got used to the changes in the way they practice in terms of the providers, as they got used to it, they probably have gotten more efficient. Whereas early on, every time someone might have a new question, it was probably like, well, what are we supposed to do with this? Right.
Yeah.
And trying to keep people isolated so that in case they're positive that they don't infect other people in the emerge, like all of these things had to be thought through. And
completely. It was and a lot of doctors are doing things virtually too now. They won't have, my doctor, you can't, it has to be dire in order to head into the office. So can you tell people, Tim, just a little bit about yourself for people who don't know you online? I'd love for people to know a little bit about your history.
So, I mean, where do I start? So but I studied quantum mechanics, like Duff had pointed out before, which was very odd. I was studying theoretical chemistry in my graduate school.
I did that too. So.
That's a little thing. And I at the same time, when I was much younger, I was coming out and I set up the Lesbian Gay Bi Youth Line, and I was volunteering there, and I got really interested in in mental health in the queer community, social justice issues, like that sort of stuff really struck my interest. And as I kept going in school, it was getting further and further away from the things I really loved. So I eventually decided to go to med school with the plan to become a psychiatrist. So I went down to the States to do medical school in Baltimore, which was an amazing experience. And actually, thinking about race issues in America, Baltimore was south of the Mason-Dixon line, a lot of racial division. It was very few, but some Black medical students at that time, and including one of my mentors, he actually been the first Black physician there, and he was probably 80 at the time I was there, and we would have conversations. It's just fascinating, like how that impacts, right, in a community where around the hospital, so I was at Johns Hopkins, the hospital is in the middle of an area that is probably 95% Black. And Baltimore is very divided between white and Black neighborhoods. my husband and I went dancing one night to this place called the Paradox, which was lots of fun. We were the only two white guys in the whole place.
Really?
And an older black man came up and says, "What you two boys doing? Aerobics?" Like, and he's like, "You look like two pieces of salt and a sea of pepper." And it was so weird. It was like, we just like, well, the music sounded really good, and we went out, and it shocked us how,
because we're not used to that in Toronto, right? We're so
not
integrated. Like, yeah.
I mean, I get there is still racism here in Canada, and there's issues. The separation of communities to that extent. I mean, it still happens in Toronto. There's places you can go where you see, like, in the more impoverished areas, and we know, like, the health statistics tell us that people who are of color, we think are getting COVID and suffering negative consequences of COVID at higher rates.
Right.
How much is about poverty? How much is about,
resources, medical resources too, right? Yeah.
Where we put, like, I remember early on in my residence. So after medical school, I came back to Toronto to do residency. And that's where I was hearing about things like the Jane Finch corridor. Like, there's no, like, hospitals and are very spread out there. Whereas if you're downtown Toronto, we've got 4 or 5 of them all in a very small area. And so the actual pregnancy, like, problems with pregnancy and in early childbirth complications are higher in the Jane Finch area, and yet you don't have a hospital to be able to deliver babies when there's problems, right? So, like, all these sorts of things kind of impact all over. And so then I did my psychiatry training, and I did some statistics because I'm interested in research, and all sorts of fun stuff. But I kind of my main love and my whole reason I got drawn into this was kind of about social justice and about the ways that our society and our experiences around us influence our mental health. And so suggested talking about this, I got very excited by it because I think that there's a lot of ways I'm hearing from many people that COVID is having pretty big impacts on people's sense of mental wellness right now.
Well, yeah, right. There's also just so many different levels of it. There's so many different types of people as well. Like, I ran into my friend the other day, and she said, "You know what? I'm fine with this. This is, I'm okay. She's an actor. And so we're used to, as actors, we're used to having down periods where we spend a lot of time with ourselves, but we also spend time with large groups of people. So being alone is actually okay with us because we're so used to being around our audience members and so many people that actually alone time and lonely are two different things. Like,
yeah,
definitely. Right.
Yeah. And we were talking yesterday about those kind of two things, right? Like, I've been reading a lot lately about loneliness and social isolation, partly for this project I'm working on, try to develop mental health and substance use resources and services at a sexual health clinic for gay, bi, and other men who have sex with men. It's going to open in Toronto. And
well, that's great. What do you have a name for it?
It's called HQ.
HQ. Okay.
It's a whole group of organizations that currently work in the sector, like AIDS service organizations, like the Black Cap, AIDS Community Toronto, and other AIDS service organization, ACAS, the Asian Community AIDS Service, as well as people who provide mental health services, like Center for
great. All under one umbrella.
And and they'll be with one place. Part of the idea is to give sexual health testing more rapidly. They do this in London, England, where they have what's called the Dean Street at 56 Dean Street, and they have Street Express. So if you want to get a HIV test or a syphilis test or gonorrhea, chlamydia screening, and you don't have any symptoms, we just want to get you tested and make sure that you don't have something that you don't know about. You can go in, you book online, you go in, you answer a couple questions, they hand you the kit. You go into a room that's like a phone booth. There's a video showing you how to swab. There's no doctor or nurse doing this for you. You do it all yourself.
Really?
You put it in the wall. The vacuum tube sucks it away, and then they text message you your results in 3 or 4 hours. So it's great, efficient, and it's meant they've got many more people getting tested, and we know your status. Just like we're talking with COVID, if you know you've become infected, you can take all sorts of measures to protect the people around you, right? You can make sure that your family knows that if you have someone that that's immunocompromised, if your grandmother you would normally go take care of, but now it's like, ooh, I don't want to infect grandma. Yeah. Right. So there's all these sorts of things that knowing is very helpful.
Well, yeah. And that's actually, Karen said she's a health worker. So, yeah. You're welcome, Karen. Thank you. That is a deterrent though for a lot of people, is the testing. I have a friend that lives next door to me, and he doesn't want to go get the swab, the what do you call it? The pharyngeal
Nasopharyngeal swab.
Nasopharyngeal swab, because it just looks so nasty. But hey, it's you're not going to be like screaming and yelling. It's uncomfortable, yes, but think of like you're protecting so many people and protecting yourself as well, right? And that's the important part. It's like those little tests can really save you a lot of time and save lives as well, right?
And like I think Karen was mentioning about the 80% accuracy. So there's this idea of false positives and false negatives. So like if you have a test, and the way that we're doing them most often in most jurisdictions is they have some sort of swab type device that they're going to put through your nose to sample the sides of and back of your throat, essentially, right? So uncomfortable. On the other hand, what we know is that we're highly suspicious that when people first get infected, it's about what they've breathed in or through their nose or their mouth. And the first infection is somewhere either in your nose or the back of your throat. And that's where it happens.
I see. Okay.
But it doesn't stay there. So for some people, it then moves down to their lungs. This is why the pneumonia as part of COVID is the thing we are most concerned about.
Yes.
Get people really sick.
And then it becomes an infection, right, Tim? Then it becomes
it's still an infection in the back. Like, so for kids, they think that they're finding like Kasharsky's. There's a few different syndromes that happen, but the infection would just be at the back, and then their body's reacting to for some children, the body reacts to the infection, and that causes a new problem that's caused by COVID, but can happen from lots of other types of infections.
Right.
But that infection, wherever it gets started, it can be how bad it gets tells you how much it's going to affect you. So people like lose their sense of smell. There's all that sort of stuff we've heard. Yeah. But if it actually moves from there down into your lungs, it could stop being in your nose. For some people, it stays in the nose and it's in both places now. And some people once. So that when it's it's over quickly. That's true. They do it. It's in and out right there. We're not leaving it in there and leisurely. Right?
Yeah, exactly. Does it hurt yet?
Yes. No. Q-tip sticks. That's like a big wad of cotton ball up there.
I think a spinal tap is worse than anything, actually.
Yeah. So you can get through this one.
Yeah.
So, but that's the thing. It's people also can sometimes just be anxious about getting tests and getting test results. Right. That's a real thing too.
Well, yeah. And so let's go back to the social distancing and what effect that has on, and the isolation has on all of us. It's, as we were saying before, is there's different types of people and different types of situations, right? There's a lot of people with addiction problems, with conditions, high stress, people who are already at a certain level. So what kind of advice and what kind of how do you think this has affected those people? And how
I think three groups of people, right? Yeah. I kind of think that there an analogy I've been using lately is thinking about like dental health, right? We talk about our dental health, and most of us try to make sure we brush and floss every day. It's this kind of dental hygiene stuff that we do, right? And it's not because I got a cavity that I'm doing it. If I only floss my teeth when I got a cavity, I'm going to have a lot more cavities. I do it every day so I don't end up with lots of cavities. Well, there's some stuff that's like kind of mental hygiene stuff, things that we typically do all the time to kind of keep ourselves well, whether or not we have a problem that everyone sorts of does. And those are things like, reaching out to people, communicating with our loved ones, being touched, having sex, just things that are like parts of our mental health needs.
Yeah. Simple human things, right?
Simple human thing. Thinking about our situation, problem solving, communicating our emotions. Those are things that are like that we all do in ways to try to minimize the feeling not well mentally. Yeah. And then there's the stuff like, we don't go to the dentist once a month, but we go every 6 months probably and get our teeth cleaned, right? And that part isn't actually done by the dentist. That part's done by the dental hygienist, who's like, making sure that we get rid of the plaque and we prevent any problems from happening. Right. Yeah. Prevention. It's also sometimes you go book that appointment because, that tooth hurts. Yeah. Or it's sensitive to cold, you're not sure why, you go see, they say, oh, you need to floss more, or let's try to do this to kind of solve something before it becomes bigger, right? So it's like, it's preventing things that are already a little bit on the page, and that stuff happens in mental health too. That sometimes you like, I'm just not feeling good, and I haven't been feeling good for a while, and I need to change things up a bit so it doesn't become something bigger, right? It could be like, okay, like right now, I was talking to a friend who works at the LCBO in Ontario. That's where people go to buy alcohol, right? Because we have this.
I have no idea.
Other countries don't always know about, right? Like, you can't just go. Now we can go to grocery stores, but that wasn't always the case.
Yeah, it's true. Right?
They've doubled the amount that they're selling. Now it's very interesting. Like, maybe what's happening is people who would go to bars can't anymore and are buying there. But it's also possible people are drinking more. You're bored, nothing to do, you drink more.
Yeah. Or I see more pot stores opening up too.
Yeah.
Yeah. Yesterday, I was like, every store that closed that was a restaurant is now a pot dispensary.
And the bars that are and restaurants that now just can open and sell alcohol right from the beginning.
Yeah. Right off the street. Yeah.
I just noticed that comment. The struggle for huggers is real. Like, I have to say that this is something that even when in those times that I'm doing my social distancing or I have to deliver something to someone, so I drop it off and I back away, and there's that moment where you're like, I'm so used to hugging people.
Yes.
Touch is like such an integral part. And so those two areas, just those first two, like the mental hygiene and mental wellness, maybe we'll call it, right? The things like, I'm starting to feel not well, but I need to do something to improve my wellness. Those areas are, I think, for everyone, the isolation, which is different than loneliness, because you could be isolated by yourself and not lonely, right?
Yeah.
There are monks that live in by themselves for long periods of time for spiritual enlightenment. Like, so you can be not lonely, you can be isolated and not lonely. But for most of us, being isolated for long periods of time leaves us feeling lonely.
Right. And this isn't self-imposed. This is like imposed upon us, right? This is like, this is what you have to do. So that's also different too, right? That factor of like, oh, you don't have a choice. You have to do this. And
that is interesting, because I was working at a hospital earlier on, and I think that when I was working at the hospital, the fact that the people working there at the very early days, when we didn't really know how is this transmitted, and there was like, you can't wear this mask, you shouldn't be wearing the mask, it's freaking people out. And healthcare workers were getting stressed because they had no choices, and not having choice is very difficult to handle, especially when our anxiety is high. Because most people, when they get anxious, like to control things.
Right.
And Karen's come into that third group I was going to talk about. So there's like the group of, like, all of us have mental hygiene needs.
Yes.
Right. We do these things to take care of ourselves. The mental wellness stuff, if things get off the rails, we start. And then there's, if you actually have a disorder, like if you've struggled with depression or anxiety, or you struggle with a substance use problem, or you struggle with schizophrenia, like, then if you already have something that's kind of difficult, and then you add all this isolation on top of it, this makes it very difficult for people. And so there are, I've seen people that I was treating that for their mental health problems, where this has made things a whole lot worse for them.
Yes.
And
so what tools have you given them, Tim? Like, let's say you must have someone with a personality disorder. Where does that person go to? How do they cope during this time? Like,
I mean, this has been the struggle, because one of the things that most of psychiatry, and I've seen lots of therapists now in the community, have switched to virtual meetings, right? They have made sure that they use Zoom, or in Ontario, we have a special, very secure network called OTN Hub. And we have shifted from where people before wouldn't do things over the phone, where now we'll talk to people by the phone. So I've talked to some since I'm not working clinically, but some of my former patients kind of reached out. I've had conversations over the phone to talk to them. To kind of be able to think through, like, how is this impacting you?
Yeah.
And what can you do? And so I often think about these two types of ways that we can approach addressing when we're feeling our mental health is impacted by something outside of us that is kind of an event that's happened, right? So like, grief is an example. Like, you don't get to choose if someone you love dies. When they die, it's devastating, right? Just like all the stuff that's happening with Floyd, like, as the impact and thinking through what that means for you, like that happened. you didn't plan that event, it happens, and whatever comes up for you comes up for you.
Yeah.
The response, however, can be twofold. One is you can try to do something about the event, right? So people, in the Floyd example, they go and they protest, or they write a letter to the MPP, or so there's things that we can do when we're isolated to help us feel less isolated.
Right.
So like we were talking, what I've thought before, something that I've done actually in this is that for me at these sorts of times, I'd want to be helping people. I don't work in a hospital right now.
That's your nature, right?
Yeah. And so I took out a folder that I have of thank you cards that are from people to remind myself that like, oh yeah, like I've helped people and maybe I can't do it right now, but
so cards that people had given you in the past?
Yeah. And it was just like,
that's so nice.
Like, I'm feeling this way. And I think this would help me if I went, this was helpful in some way, but I can't do it right now. So how can I remember that I have been able to be helpful in the past? Right. Similarly, if you can't get out to connect with people because you're immunocompromised and you're just following our social guidelines, then you might want to figure out what are the ways to connect with people using Zoom, we've been doing watching parties. I've heard lots of people doing watching parties. In fact, there's a whole queer youth support group in Toronto that they've increased the frequency that they hold their social events. They're all online. People could chit chat, and then they watch a movie together. And so it gives them an opportunity to hang out in this alternate way.
Yeah.
Now, it's going to be hard for people if they don't have, like for me, part of my worry is I often did a lot of work with people who were impoverished, so they didn't have a phone or they don't have computer access or internet access. And for them, I'm particularly concerned. Like what's happening to the homeless in Toronto, it's very difficult, right?
And worldwide too. So what is being done in that regard with homeless people, because that is a huge issue. Also testing with them as well, because they are interacting very closely with each other, and also people on the streets. I've noticed on the subway, someone will come at me, no mask on. Thank God I had a mask on, but I was, before you know it, you turn around and someone's right in your face, spitting all over you. And it's just like,
so partly what they've done in Toronto, at least, and I think some other places have done this, is they've turned to hotels. I mean, hotels are empty right now because people can't be traveling. They're renting hotels out en masse, and they're instead of housing people in shelters where they're in bunk beds, many to a room where it's just a recipe for transmission, we're separating out. Those same people then, now that they're working in those other environments, the issues that they had, the mental health issues, the substance use issues, they haven't gone away. So actually they're doing a lot more training. And so I'm going to be doing in the coming weeks some training on methamphetamine use and what happens when people become psychotic when they're using methamphetamine, and how can you help support people so that they can kind of help people in those environments and respond in ways to keep them well. So part of the idea is to make sure that people that are around them can support them.
Yeah.
Making sure they have access to the PPE they need, right? Masks when they're going to be out. Those are all important. And I guess the other thing that we kind of hinted at here, there's this, what you can do physically, for anybody who's kind of feeling isolated, to try to to be connected, to try to feel connected even when you're not. And part of it's a shifting our mindset. So sometimes it's in our mindset,
right?
That we think about, well, how does the person who is isolated but doesn't feel lonely, how do they think? What do they do? What do they do? And it's the shifting in our thinking that sometimes can affect our emotional state. Yeah, right. And so that's the other kind of flip side of things, is to think about, well, what could I do differently in my thinking? Yeah.
And in some ways it's kind of, I guess, ironic in some, that the hotels emptied and allowed for homeless people to move in. It's kind of profound in a way as well, right? Like this everything's taking care of itself in some weird kind of strange way, which also I seem to think about COVID and the racism happening simultaneously. What are your views on that? Those two things happening parallel sort of.
Yeah, they're parallel stressors, right?
Yeah, right.
One stress is, and it's not like racism suddenly came up, right? But it's like that suddenly we're confronted with it, right?
Yeah, right.
So people who who were, and so again, this is kind of like in one's mindset, right? So I've been hearing from friends that say like, actually, they have some hope. Like one of my friends, Jay, wrote a whole blog about actually hearing this discussion and the breadth of people who are now talking about it.
Right. Actually,
some amount of hope.
I never thought about that. The feeling of hope is actually palpable, right? That's
and he says like there's this thing about all these corporations that want to make statements. It's like there was an era where they would have said nothing. It's like, not my business. I don't care. And now people are like, we have moved into an era where I think institutions themselves want to be more enlightened. Now, they can say something, and does it really matter? What kind of impacts? Being held accountable is something that's being communicated.
Yeah.
And again, I think it's this thing about, I always think about what's the emotions that come up with it, right?
Yeah,
so
right.
What's the emotion that comes up with COVID? I think for most people, it's about anxiety. Like, it's worry. This is something that's like, I can't control. I don't know if I'm exposed, if I have a symptom. I have allergies this time of year, and I've been thinking like, is this COVID? Every time my throat kind of hurts and gets scratchy, and then it's like, oh right, I forgot to take my antihistamine this morning.
Yes.
There's this sort of like this way that we are primed in a pandemic to be anxious. Now, why that might be helpful in a kind of developmental thinking about like, as an animal, what's anxiety do for us, right?
Yeah.
Is that when we worry, and we tend to keep ourselves sequestered to keep ourselves safe. Yeah. So worry might have us be more vigilant and look out for dangers. Right. When we are anxious for long periods of time and we're watching out for those dangers all the time, it's like we're revved up. It gets exhausting. Yeah, right? It's like a constant vibration. So what would you say to people who are highly anxious right now in that way? What sort of things can people do? So, there's this, back to that 2 ways of thinking. You can shift your thinking. And that's some of the stuff that I grabbed out was to show people where some of the books that people use to try to help shift their thinking. One of the most famous one is this one called Mind Over Mood. Oh, great. And Mind Over Mood was written by this Christine Podesky and Dennis Greenberger. Okay. It's in the 2nd edition. It's a handy little workbook. It's generally pretty inexpensive most places. Lots of the public libraries have them too, and in electronic versions. Of course, there can be some waits to get them, but this whole book helps you think through, in what kinds of situations am I thinking about? Do I get anxious? And what exactly do I say to myself? Because part of the thinking is that the way we think creates our emotions. Yeah. You could be in let's take an example that's probably hard to imagine in the middle of COVID, but if you're in a restaurant and the waiter or waitress just never comes over and ignores you, if you think they ignore me because no one cares about me, you're going to feel very differently than if you look around and say there's tons of people in the place. You're like, oh my goodness, this poor waiter or waitress who's got this many people and one person trying to handle all of them, right? That's 2 different emotional states, and it has everything to do with the story you're telling yourself about the situation. And so that book's all about that story. That's brilliant, actually. Some things you kind of go like, well, actually, so there's another kind of therapy that's based on that. That's called cognitive behavioral therapy. Oh, okay. Yes. Then they made this therapy called dialectical behavioral therapy. Now this one, that's not to go this way. This one. Dialectical. What is dialectical? Dialectical. Dialectical. What is that? This idea that if you take a premise, if you say the world is round, then it infers that there's an opposite belief. The world is flat, right? Like we kind of think if the world's flat, the world's round. People get into this debate of one versus the other. Yes. Right. So that's a dialectic where you've got like a thesis and antithesis. Right. Yeah. Well, for emotions though, sometimes you go like, oh, I'm scared because the world is dangerous. It's like, oh, so if I wasn't scared, a world wouldn't be dangerous. Like, so sometimes what you realize is that there might be the whole thing isn't true in its totality, but there's a part of it that's true. And if you can figure out the part that's true, it's like, okay, I'm feeling anxious right now. And there may be something risking my safety right now, but it may not mean that the whole world is dangerous. No, it's not. But if I flip it back and forth, but the world is dangerous and I don't do anything, and then taking lots of risks because, fuck it, I don't care about the risk. That's kind of like being in a dialectical dilemma where you kind of flip back and forth because there's some kernel of truth. And in this, is a kernel of truth is that we need physical connections.
Yeah.
Feel good. And physical connection right now has risk. And so that's a tension, and it's a dialectical tension. So in this way of thinking, so Marsha Linehan took this mind over mood idea, the way that we think creates our emotions. And she says, wait a minute, sometimes that way of thinking is actually accurate, but it's maybe too extreme. And she just thought of it a little bit differently and added this dialectics idea.
Oh, okay.
And she said, in certain situations when we're emotional, we want to ask ourselves, does the situation fit the facts? Does our emotional response really fit the facts of the situation?
Right.
And if yes, okay, the next natural question is, would responding to the urges that this emotion gives, would that be helpful? So you can be in a situation where being scared, it fits the facts. This is a dangerous situation. And then you ask yourself, my fear wants me to run. Is running the right thing to do right now? Is hiding the right thing to do or not? And so that's a way of thinking.
Right. Yeah, that's was it don't let your emotions run your life or rule?
Yeah, run your life. This one's
run. Okay.
This is a more accessible version of a therapy that Marsha Linehan. You can find Marsha Linehan's books, but they're very theoretical in some ways.
Oh, okay. Like a bit heady.
Yeah.
Well, that's actually what I got my
That's a great recommend. Panic to Power by Lucinda Bassett.
Oh, okay.
I'm gonna look that one up too. I hadn't heard of that exactly, but there's
Lucinda Bassett. Okay.
There's another theory. There are a few different theories on anxiety. The other theory, most of anxiety theories suggest that the best sort of treatment for anxieties is expose ourselves to the things we're anxious about. Now, that makes sense when the thing you're scared about isn't dangerous, right?
Yeah, right.
So it's right now we're in a little bit of a tough situation where, I wouldn't like, so for instance, with people with OCD, sometimes you'll make them touch toilet bowl,
it's like Howie Mandel, right?
Food without washing their hands, which is very difficult for them because the actual risk of getting sick is very, very low. It's a way to just combat the way thinking. I don't think right now in the middle of COVID with people, they decide that you want to, that this is the greatest way to approach it, right?
Especially
so what are the safe things you can do?
Yeah, like emotionally first, right? Physically, we're sort of in a different boat, right? Because there's so many unknowns, but emotionally we can do a lot for ourselves, like on solo. And some people also, you and I were talking about, people also have built-in social family network that's helping them. There's also, so there's that, right? That element that is helping people cope. But people who don't have that, I guess what you're saying is that connect with people, right?
Yeah,
as much as you can, reach out.
We all still need that connection. You're absolutely right. And I really feel for friends who like live alone, right? Like because the way we have, exactly, right? Like and so there is this idea that's being put forward now about creating bubbles.
Right.
The idea is that you like, I live in a house and there's two of us, but I have friends where their families, there's two twins, they're both married with kids, they live a few streets apart. They're so used to like relying on each other for childcare and the rest that essentially they're a bubble. They've stayed separated for a long time. And now they've said, we've gone this long. Neither of us is infected. The one family was a bit of a scare. They got tested. They're fine. But now they're going to join together and act like one unit. But then that unit has to make sure that they're not also joined to another unit. Right. So I think that's the way the bubble idea is, that you say like, you find a few people and you kind of establish, this is how we'll hang out together. Yeah. But we need to make sure that it's only these people on this list. All of us are agreeing that this is the list of people we're hanging out with. And as a bubble, we're trying to minimize our exposure outside of that.
So, when all this stuff happened with, for people who didn't know, in one of Toronto's parks, there were a lot of people that were reprimanded for being in these large groups together. As far as we know, a lot of those people were bubbles, right? People who lived in the same house who had been tested. We don't know. We were assuming that a lot of those people, were just meeting there randomly, but but as far as we know, right, a lot of those people could have been in their sort of bubble of like living in a dorm at college or right.
Lots of students who probably are 4 or 5 in a home they're rented, whatever, or like it's 2 or 3 people and they live in a basement. Like a lot of that area around there has a lot of student housing that is basement apartments. I spent a meeting this morning with one of the research assistants for a project, and I can see that little teeny window at the top there from his basement apartment. And I can't imagine if you've been living with like not only kind of isolated, but with no light for that time.
Oh yeah.
Suddenly you have this much, like you can see the sunlight outside, the weather is beautiful.
Yeah. Right.
I appreciate why people did it. And I think that, the thing that lots of other cities had done is put those circles. They've now painted those circles.
Yeah.
What part of their day people are sitting in the circles. I think once you provide structure for people, they try their best. Right?
Well, it goes back to what we were talking about. It's like preventative instead of reactive, right? If we had thought ahead, and I mean, it doesn't take much to look at other models. Other cities have done that, right? And taken that and used it. All we needed to do was look to our neighbors and see, oh, they have large parks, they have a large population, a dense population. But anyway, there were thousands of people too that were crowded into the park. So that's a whole other thing. But
and we know, like, people have been commenting on the protesters and being like, people are trying, and it's a tension, right? Like we all are, and we know this from other illnesses, right? Like and other diseases, like HIV being a prime example, like that you talk about safer sex. It's like it was unrealistic to think that people just stop having sex. It's unrealistic to think that we can live our lives without social connection.
Right.
We have to rethink how we do this more safely and how we make it possible so that we can track, if you turn out to have been exposed, how many other people might you have exposed?
Right.
So part of the issue is you have to kind of be thinking of that total number of people that you are in contact with and keeping that lower, right?
Right. I don't think there's enough talked about on that platform, because I think that's really an important element, is to have those bubbles in order to contain all of this, right? So can you go back to talking about, I am still so intrigued with what people can do in order to keep a healthy mind. And for you, say touch and connection is important, but there are gay, straight, whoever, people out there who haven't had sex in 6 months, probably. What do you think that people can do in terms of keeping a stable mind on that front, in terms of touch and affection?
Yeah, I think this is where I think this is not, probably people in public health may have their own opinions on this. And I kind of thinking back to HIV,
right,
and what happened in the early days of the epidemic. It's like, we were just suggesting that you need to think about this safely. And so I think right now, the meeting a different person all the time is a very bad strategy, right?
Yeah.
On the other hand, I think that it's not unrealistic that people might have, people that are in their life, that sexual partners that they continue with, whether that's someone that they see regularly or but that we all have these, we have to balance several needs for our health. And I think it's important for us not to be judging people about the decisions they make, but supporting them to make decisions that try to keep most people safe. And part of that, we know, is just about communication and open communication. So, you don't want to be, you want to kind of know who you're having sex with and how many other people are there, and having these sorts of discussions about the risk that you're taking. When
it's almost like the 6 foot rule or 2 meter rule is actually the condom rule. There's the shirtless man walking.
I told you, Elliot would eventually appear shirtless in the wave.
It was inevitable. This is very good viewership.
We were looking forward to,
Hi, Elliot. Yes, but that's actually, so it's almost like the 2 meter rule has now become the condom, right?
and like I think there are ways that people are doing this that involve not getting together with people, right? So people are using internet, and I'm sure there's plenty of chat rooms that are
we should have invested.
Right, we should have invested in it. There would be a great need. I imagine that these sex shops are selling delivery dildos at very high rates.
Oh yeah, exactly.
So
Hello dildo instead of Hello Fresh, it's Hello dildo.
And why doesn't Uber also go to sex shops?
Right. Yeah. So, I think well, it goes back also to and the similarities between HIV and AIDS and this are kind of bizarre in some ways, is that when the whole HIV pandemic happened, the thing is that we couldn't basically have sex. Sex was like a no, right? Until we figured out, we could still have sex, which is a big shift for us as humans. Still have sex, but be very safe. And I think that's what's important here too, right? Is safe. Still assume everyone's positive, like COVID positive, right? In some way.
One of my family physician friends said to me, we have to act like we're all going to become positive at some point.
Right.
Because it's a little bit more like with HIV, we knew how to prevent transmission. Yeah. And with COVID, it's less clear. Like, I also heard about people that they've done everything. They've done everything the way they were told to, right? Yeah. And they test positive for COVID. And like, but I did everything right. It's like all these things we talk about are about decreasing, we think, the risk for you to be exposed. We don't know exactly the ways that some of this stuff may be spread, and given that it aerosolizes,
incubation as well,
it gets onto surfaces and can be left on surfaces. We just don't know like how much has to be there before my touching it and then scratching my eye later. Like, is that enough? Right? Like, and these are things where like it'd be impossible to monitor ourselves to that degree to be able to be 100% sure that we can prevent the transmission. The other part that I think that the other books I have here is like there's the kind of stuff we talked about, which is very kind of psychological sciences. Yeah. But crossover between mindfulness and self-help and kind of just awareness and meditation, these sorts of things I thought like are useful things to think about. So there's a lovely little book called The Mindful Path to Self-Compassion, right? Oh, right. Okay. It's very nice to think about, being kind to ourselves and how being kind to ourselves is in fact an important part of staying well emotionally. Right?
Yeah, it really is. Yeah.
Who wrote that, Tim? This one is by Christopher Germer.
Okay.
And this is one that I've recommended to people and that I've had many patients actually kind of tell me about and already knowing it, but like it's well liked, I'd say, this one.
Yeah.
And that is related to a whole group of therapies that have combined that mindfulness approach. One's called acceptance and commitment therapy. And one of the people who was big in acceptance and commitment therapy wrote this book, The Happiness Trap.
I've heard of that. Yeah.
Beliefs we have about happiness.
Right.
Saying like, look, this idea that we have to be happy all the time isn't realistic. And it's about accepting the states that we're in and working with them the way they are. So that's
you can do, there's audiobooks on these as well, right? Put it on while you're doing your work through your home or on a long walk. A lot of us are going on long walks by ourselves. And that's a great thing to sort of like reprogram your mind, right? That's what it takes, is just tweaking those thoughts and just starting the slate fresh.
And our mind is more like, we often in psychiatry have this idea of biological, psychological, social, and spiritual. That those all comprise. And so sometimes in times like this, a strong spiritual practice or kind of thinking about what do I believe in and why do I think I'm here? What do I think existence is? Like big questions, right? Yeah. And wherever we stand on those things, sometimes a spiritual, in times of suffering, spiritual exploration can be soothing.
What kind of example would that be for people, Tim? Like what type of a spiritual practice would?
So some people like prayer, meditation. I think this is why it's very difficult for some people with who are very involved in churches right now, the fact that churches are closed.
Yeah.
So I think, some people's spiritual practice is very individual. So it can be, and some people it's in groups. I think that has a lot to do with people's personality, right? Some people are introverted and do things on their own a lot and like that. And that's where they get their energy from. And some people are extroverted. They get their energy from interacting with people, right?
Yeah, that's me for sure.
And the extroverted people right now, I feel for, right? My mother is an introvert, and she told me about this book that she read called The Introvert Advantage, right?
Oh, okay.
Nice. Now, right now,
how quiet people.
It's an extrovert word. Right now, it's like extroverts are having it hard, and introverts are like, hey, hang out at home for 6 months.
Fine. Yeah, exactly.
Right, whatever.
See you in a couple of years. Yeah.
And one thing you can do is to kind of understand how your what type of personality are you, right? There's some online tools you can go to look up personality assessment or Big 5 personality assessment and to know. But yeah, back to the kind of idea of the spiritual practice, there's prayer, singing, things like reading on topics, whether it's like on topics of Buddhism. One of my patients once had read this book and suggested it to me, and I ended up reading. It's very nice, called Untethered Soul. And then line with like the Eckhart Tolle, whatever, I'm getting his name wrong.
Eckhart Tolle.
Eckhart Tolle.
Okay.
So there's like,
I know that. I wonder.
Yeah, there's a bunch of stuff you could be reading right now.
That's
you can
true. Yeah.
join, like Karen suggesting, like group chats and conversations about these things. People do services online, podcasts. Right. Yeah, things that help you. Sometimes we can feel a deep sense of connection by connecting spiritually to the world, right?
Yeah, and creative energy is really important too, right, Tim?
Totally.
Whatever that means for you, whether it's doing macrame or like knitting or painting, writing, like anything, right? To sort of
like people like me who have like terrible, like I'm good with stick figures, right? So,
I love stick figures.
Someone lately circulated something about the Kentucky Fried Chicken guy with what was his bow tie.
Oh yeah.
But when you look at it, because it looks like a big body, and someone says, "How come no one ever comments about how small, Colonel Sanders' body is?" So that looks like the kind of body I'd be able to draw, right? Like,
yeah, right.
But I got my sewing machine out, and that's kind of fun.
Oh wow! I can't wait to get a blanket from you or something. Curtains, new curtains. Well, that's the thing too, is like you can come up with projects in your Karen said art, script writing for sure. That you can come up, you can create projects as well. Create like this whole thing I'm doing right now, I just created with and I thought, and it was a way for me to make a difference and connect with other people in other countries. And now it brings me so much peace actually to sit, even just to talk with you, who I never see anymore. Because, but also friends who I haven't seen in 30 years and who have a wealth of information about their lives. And so it's a way, again, of connecting and making a difference.
You've given an example where you've kind of said, like, you saw a place where you could be helpful. It's giving you kind of a meaning and a purpose, right? Yeah. And it's expressive. Yeah. And some people do their expression in a public way, and some people do it in a very private way. So like the journaling and art and sculpture and singing, and for yourself or for others, like different people do it differently.
Whatever that is for you, right? Yeah.
And we got a lot of time on our hands. Now's a good time to sit back and kind of think of like, which of those things that give me meaning, which things bring me happiness, right?
Yeah, exactly.
And the last little book I have, which I really, really appreciate, I read it. It's called "What Happy People Know."
Oh, okay.
And this is by this guy Dan Baker.
Okay.
In Cameron's office. So Dan Baker is a psychologist who does a bit of DBT and CBT, and he.
Wait, what's DBT and CBT?
Yeah, he likes those things, but he.
So what is that? What is that?
This one here.
No, what is DBT and CBT?
DBT is the dialectical behavioral therapy, like the
okay.
the cognitive behavioral therapy.
Right.
They're all the same set of school. They're very popular these days. There's lots of other therapies that are great. Those are the ones that I happen to have fast books. Those people tend to write a lot of books.
Yeah,
and they're accessible.
So that's What Happy People Know by Dan
Baker.
Dan Baker. I'm just making a thing so people can. Dan Baker. Okay. Okay.
Whatever rocks your boat. I totally think that's a great way of saying it. This is so this guy, Dan Baker, runs the Life Enhancement Program at Canyon Beach. And I think it's a bloody expensive program. So basically he works with a bunch of rich folk who realize they ain't happy. And so he points out, don't think money is going to bring you happiness, because he's seen plenty of miserable rich people.
That's
He says,
I find a few orders from Amazon have made me happy. Even though the Jeff Bezos is probably happier than anyone in the world right now. That's for sure.
Yeah.
So those are some really great books. Thank you, Tim. Those are great resources. Now, for people who are there globally, because who knows where people are tuning in from here. Yeah. Globally, where can people turn if they are actually struggling at home? Like, is there a phone number or a helpline, or actually a website that people can go to?
Yeah. So one way to think about this is most countries either have the country running the healthcare system or their provinces or states. And so it's useful often is to go to whichever one in your jurisdiction does it. So in Ontario, and in Canada, it's our provinces. In the US, it's mostly the states that deliver healthcare, right?
Right.
In the US, it's even more like often very local towns might sometimes be the ones, and the cities who build hospitals for public access, right?
Right.
And so most of the time, that means they also fund crisis centers. And crisis centers are a very good place. In my day, I remember opening the white pages, and the front page had, like information that included for distress centers, for helplines. The thing I was thinking about, interpersonal violence, like partner violence, intimate partner violence right now, we're very concerned about, because, now everyone's sequestered. You might not see that someone's bruised. Ask that question, like, is everything okay? Something happened at home, right? So, and people are now in these very tense situations. So the resources for the sort of shelters and emergency women's shelters and emergency women's services tend to be listed. Googling them is the best thing you can do in your area, right? And looking up the stress center in the UK, and in Canada, we have a lot of these kind of volunteer run centers.
Right.
In Ontario, we have we have an online service for searching for mental health services. And
that's interesting. We go to one place and it gives you all the different types of things.
Yes, it's ementalhealth.ca is a website, and they have a place where you can search for a type of service. You can search for a particular psychologist. If you know a name, you can put your city in and see what's in your city.
Okay.
And so
that's great.
There's like resources like that. Unfortunately, because there's no good directory across the globe for it.
Yeah.
There's Good Samaritans is what it's called in the UK. It's the volunteer organization, the Samaritans. They run help phone lines. Most countries have some version of that.
Yeah. Well, we are in a crisis. So, that is the thing to do, right? Call the crisis line, especially if you're experiencing like violence in the home. And that is a huge problem, like you said.
And mental health resources, like if you are stuck and you have no idea what to do, try your family doctor. If it's totally urgent, you can always go to the emerge. They always have a psychiatrist and social workers in the emergency room to deal with mental health struggles and substance use struggles. So those are kind of common places that have resources.
Yeah.
Sometimes if you do have something that's not incredibly urgent, you go to an emergency room, you're going to feel kind of dissatisfied with what you get. So it's finding that right level. Family doctors are often know in their area what's available. In mental health supports.
And you shouldn't dial 911, right? That is the thing that people should not do.
There are some situations where 911 is appropriate in mental health. If you are suicidal or someone is attacking or threatening everyone in a home and you really think like they're going to lose control, at that time, 911 is not such a bad idea, right?
Right. Okay.
But those are kind of like those rare things. Like I've called 911 even in a situation where I was walking down a street and I saw somebody in the middle of winter with no shoes on, clearly not mentally well. Was talking to himself and the walls, and And it's like, this is somebody who really needs to get to an emergency room. And so those 911 calls people aren't concerned about, right?
Right.
But yeah, you want to leave 911 for true emergencies, and for urgent things, you want emerges, or some places have kind of urgent care clinics, like in Toronto, Women's College Hospital used to have one. I don't think they do anymore, but there are some hospitals and some centers that offer kind of walk-in type clinic services, urgent matters, and typically they will have some mental health support.
And 411 is also another option too, right? I think you can report if you see something, see somebody in a crisis or in trouble, you can report that through 411, right?
There's also in Ontario, we have 211, and I don't know how many places have things like that.
Oh, maybe it's 211 I was thinking of. 211
is a community and social services helpline.
Yeah, I think that's the one I was thinking of, right?
And then
so people will come to that person and rescue them if they're in trouble or in need, right?
Yeah, well, we even have in Toronto, I mean, this is subject of a bit of hot debate right now, given what's happened with a young woman here, but there's a program called MCIT. It's a mobile crisis team. It's a nurse and a police officer go out to mental health calls when they get a call to the police. If they feel like the police got the call, but it's more mental health, they'll go. If there's some safety concern, they'll sometimes send both. These are big debated right now. Like, why are police having to do these things? Or why are we asking police? Why are we not better funding those types of interventions?
Yeah. Right.
Thank you. Karen just added that in the UK, it's 111. I mean, that's the thing, like, you kind of looking up mental health directory and your location will sometimes give you that sense.
If you have that option.
The other thing that people often don't think of with mental health, but priests and ministers and clergy, our pastoral staff are often trained in counseling, and they can sometimes be a first access point. And if it's beyond what they can help with, they'll refer it on. So that's another source that sometimes can be useful for people.
Are a lot of churches operational, right? I know that they just opened up, so I guess that option is even more available now, right? The priest or minister would most likely be in the church now and able to help more than before, right?
Yeah, although I think even in this sorts of times, like many people, like I have a couple of patients who actually call up their clergy just regularly, or their clergy calls them to check in because they know they've been struggling with mental health stuff.
Yeah.
And so I think that there are churches and places where there's a way to reach out to the clergy staff, and it's worth considering for some people, because wherever you feel most comfortable, we know in therapy in general, you need to feel good with your therapist and trust the person. And for many people, they've got a good, strong relationship with someone if they have a spiritual tradition, right? Yeah. For those of us who are, not particularly religious and don't, then we have other places to turn, or need to find other places to turn. And your family doctor is one place to think about regularly. They get training in mental health, and whether or not, how good it was, and that's part of their expectation of family doctors is to help with these things too.
Of course. And there's a lot of this going on, a lot of virtual meetings, and you can have an appointment with your doctor this way too. So,
and there are organizations that may not be mental health. And so what I really learned in doing this recent project on sexual health is that the 8 service organizations also have mental health supports.
Right.
There are lots of organizations that are including mental health stuff, whether it's at schools, if they're counseling programs, and there are places that you might not think of initially that it's worth asking, hey, are there any mental health supports here because I'm a member of this organization, or I use these other services for some other health stuff?
Yeah. Yeah, don't be afraid to reach out and talk to people about it, right? This is even though there's, I'm sure they're overrun with calls, but I think if you feel that you need to call, you should definitely call, right? And not feel and like you said, if that one avenue doesn't work, go to the next. Like I love this right here, mental health. So that is a number of services, which I really love. And that also HQ you were talking about, is that up and running, or is that about to?
Not yet. I mean, this is one of those things where the planning got
right.
impacted by COVID. So we have a design for a space. We've there's a lease ready to go, and we had been hoping to opening in the fall.
Yeah.
It will really have to be pushed later at this point.
Right.
But right now, the partner agencies, like the AIDS service organizations, like the AIDS Community Toronto, Black Cap, Hassle-Free Clinic, it's a sexual health clinic. They have mental health. They have social workers, and they have mental health supports there too.
Right. Tim, we've overstayed. I've kept you longer than it's a beautiful day today. We should both get out and enjoy the sunshine. But we had so many.
Turn the top of my head with the 11.
Oh yeah, be careful.
Index.
Wear a big floppy hat. I really appreciate you coming on, and we had so many great points, and I hope a lot of people tuned in and gained a lot of knowledge from what you have given us. Thank you so much, Tim, for taking the time.
You're welcome. We'll have a wonderful day, and best everybody across the globe.
Thanks, Tim. Dr. Tim Guimond. Thank you so much. Say
Bye-bye.
Goodbye to Elliot for me. Okay. Bye.
Bye.
Thank you to Tim and for doing that. So Tim is a wealth of information, as you can see, and I do recommend that you go to ementalhealth.ca. If anyone has any questions, I should have said that for Tim. I'm sure you can leave them here now, and I can forward them to you if anyone has any questions. Otherwise, we were supposed to finish about 20 minutes ago, but we had so many great things to talk about. So if nobody has any questions, thank you to everyone for tuning in. Karen, Hockey Nut, Don Ackerman, our friends, and Chad down in the south of US, and Holly and PEI. I don't know if you're still tuning in. If you love the live stream, please share it with your friends. There's some great information on here that we discussed, and great resources. A lot of the books were really important. Thank you to Karen for giving us also some great information in the UK. So thanks everybody again. Take care of yourselves, and take care of those around you, and be kind to everyone. Wear a mask, wash your hands, and socially distance. I think socially distancing is the most important thing. And as Tim said, mindfulness as well. And reach out if you need help. Okay. Peace, everybody. Have a great Tuesday and a great rest of the week. Thanks for tuning in. Hold on, I gotta do my extra.